The problem that you have is that most of the technology of today was first found as a technology, and then someone said, how can I apply this in healthcare? And the right direction is, what's the problem in healthcare I'm trying to solve? And now what technology can I apply to it? Today what you have are devices that are creating 1,000 EKGs or 1,000 readings of blood sugar. And what we need the device to do on behalf of the patient is to take all that information, ask the physician what are the parameters you want the device to follow, and let the device do the calculation to answer the most important question to the patient. How am I doing? Am I having a big problem? Should I be doing something different? Should I be cutting back? And we have that ability today. We have the data analytics. We have the smart clinicians. We just have to embed it in the devices. And most of the companies that exist today have not wanted to do that out of fear of malpractice. I think if they embed it inside of it, patients can become much better stewards of their own health, live better, and as I say, not have the opportunity to either fall through the crack or not have the requirement to get care simply on an episodic rather than continuous basis. Remember that technology in the 21st century is relatively new. The iPhone's less than a decade old, or only a decade old. The iPad is only 7 years old. Many of the wearable technologies are just being developed, and it takes a while to understand how to use that technology. I'm a big believer that it's not the technology itself. It's the technology put into an integrated care delivery system that's both horizontally and vertically integrated, that's prepaid, that's capitated, so that at the delivery system level, so physicians have every incentive to be able to use that technology to help patients to prevent problems in the first place, not simply to treat them. And it has to be physician-led. And when technology is embedded with these other pieces, then data outcomes are available to both the patient and the clinician that allows people to know how they're doing, to figure out who's doing it better, to figure out the changes that might happen. Care in the past has been much more episodic, and devices like wearables allow it to be continuous. One is the electronic health record itself, which for the consumer is a tremendous opportunity to schedule appointments directly, email directly to their physicians, check the laboratory results, to be able to manage their health from their home. The second opportunity through technology on behalf of the consumer is making sure that they don't have any gaps in their health care. They can access their own information on what's need to happen. They can follow their own course of chronic disease. And when they come to see the physician, they're able to have the right care provided immediately. As a result of all that in Kaiser Permanente, I have 1,000 programs in the country. The NCQA has ranked us #1, the only program with 5 stars for both commercial and Medicare. And then finally, it serves as a communication tool on behalf of patients, so that the radiologist finding a lung nodule is able to notify every physician taking care of that patient so they don't fall through the cracks. It's reliability, it's trust. Number 2, we're looking at video. Video, I think, will be a very powerful tool, increasingly so in the future, to essentially bring the physician into the patient's home. So video connects the patient directly. If you call our telephone center in Washington, D.C., and you have a problem that's not life-threatening, but maybe you should go to the emergency room, maybe you shouldn't, you'll see an emergency room physician, ED-trained physician, who can make that evaluation and provide that information right there and then. And finally, data analytics. Using millions and millions of electronic health records, millions of patients who have been hospitalized. We have the ability today for a patient to say, tomorrow you're going to be getting worse and go to the ICU, and so today we're going to intervene, doing tomorrow's work today. The opportunity with data analytics, tell the same patient in the emergency department, don't go home because tomorrow you're likely to come back. We have the ability with a patient with cancer to say, if you're a particular cancer in your age and your sex and your particular ethnicity and soon your genetics, here's the right treatment to be provided. The opportunity to use technology of the 21st century is here today. We're doing it inside Kaiser Permanente. We're doing it inside all of the CAP groups, the 28 largest and best medical groups in the country.